Hi, folks. Thank you for those who have joined us so far. I'm just going to allow another minute or two to go by for any late arrivals, and then we'll get started. Thank you. All right, I'm going to go ahead and get started. I want to welcome you all to today's webinar, Turning One-Off Programs into System-Wide Behavioral Health Diversion. Thank you all for joining us. For today's presentation, we'll start off introducing our speakers and organizations. Then we'll move into an overview of diversion, followed by a presentation by our speakers. We'll then have a panel discussion to dive into some of the details of the diversion interventions and diversion strategy underway in Fulton County, Atlanta, Georgia. And finally, we'll have some time reserved at the end for questions and answers. Please feel free to use the Q&A and chat box located at the bottom right-hand side of your screen throughout the presentation. Today's speakers include Kristen Sherlig, who is a court support manager at the Office of Court Administrator at the Atlanta Judicial Circuit, Superior Court of Fulton County, so a bit of a mouthful. We also are joined by Moki Messias, Executive Director of the Atlanta Fulton County Pre-Arrest Diversion Initiative, and we are also joined by Renette Arnold, who is a community collaborator at Behavioral Health Link. And my name is Sheila Tillman. I'm a Senior Policy Analyst at the Council of State Government's Justice Center. The Justice Center is part of the Council of State Governments, which is a national nonprofit, nonpartisan membership association of state government officials. The Justice Center is essentially an affiliate focusing on criminal justice issues. The Justice Center provides practical, nonpartisan advice informed by the best available evidence. We bring people together. With our singular ability to reach federal, state, and local leaders from all three branches of government, we gather people from both sides of the aisle and across the country to foster collaboration. Our in-depth data analysis, coupled with extensive interviews of people on the front lines of the criminal justice system, inform improvements and spur national initiatives. We synthesize and contextualize data to help policymakers enact and implement major reforms that address criminal justice challenges, many of which intersect with other systems, such as health, education, and housing. Our unrivaled on-the-ground training and technical assistance helps state and local agencies translate the latest research into policy and practice. We provide federally funded grantees with publications, peer learning opportunities, and connections with experts and practitioners from a wide variety of fields. Our goals at the Justice Center are to break the cycle of incarceration, improve health opportunity and equity, and expand what works to improve safety. This presentation is funded by the Justice and Mental Health Collaboration Program. JMHCP supports cross-system collaboration to improve public safety responses and outcomes for individuals with mental illnesses or co-occurring mental illness and substance use who come into contact with the justice system. The JMHCP grant program is overseen by the Bureau of Justice. BJA provides leadership and assistance to local criminal justice programs to improve and reinforce the nation's criminal justice system. BJA's goals are to reduce and prevent crime, violence, and drug abuse, and to improve the way in which the criminal justice system functions. Before we jump into the content today, I'd love to hear from you all in the audience to learn a little bit more about what agencies you represent and the focus of what your focus is on for diversion. So you'll see in the bottom right-hand corner, we're asking you through a poll to please tell us what agency you represent, either law enforcement, court, pretrial, jail, behavioral health agency, or other. Let's give you a couple seconds to go ahead and fill that out. But like I said, we would just love to hear what agency you represent and get a sense of who's on the line with us today. Okay, I think that our answers are being generated. Bear with us while we learn which agencies you represent. Okay, so a little bit of law enforcement, a little bit of courts. Sounds like the majority are other or behavioral health. I wish we had the option to have a field available for people to tell us what other agency you represent. But thank you so much for being here, and I hope that you all find this presentation helpful. The second question is I would love to hear a little bit more about where you are focusing your diversion efforts. Are you focused on pre-arrest, non-law enforcement interventions? Are you focused on pre-booking, either without law enforcement or law enforcement involvement? Are you focused on pre-trial and court-based interventions? Or are you focused on other, something like jail diversion that's really focused on processes and practices that can facilitate diversion? So again, I'll just give you a couple seconds to answer the question. And these just give us a sense of who's in the audience and what your focus is on. Okay, a good number for pre-arrest, a good number for pre-trial, and a good number for other. Those of you that are focused on pre-arrest, you'll hear from our speakers who are also focused on pre-arrest diversion, and I hope that you all will ask questions or join in a discussion later on of what you all are doing in your system as well, or what stage you're at. But again, thank you for joining us. And thank you for taking the time to do our polls today. So let's go ahead and dive into the content. So I don't think this will be a surprise to any of you on the webinar, but people who have mental illnesses and substance use disorders are overrepresented in the criminal justice system. Stedman et al. Published a report in 2009 which estimated about 2 million people admitted to jail annually have serious mental illnesses, out of 11 million people who were admitted to jail. Oops, we're going to skip this one. And on top of that, people who have mental illnesses are overrepresented in jails. So about 4% of the general population has a serious mental illness. You'll see that on the left side pie chart on your screen. When you look at the jail population, 17% of people who have a serious mental illness. When you look at the jail population, 17% of people have a serious mental illness. Of that 17%, 72% also have a co-occurring substance abuse disorder. There are a variety of contributing factors to the overrepresentation of people with mental illnesses in jails, including disproportionately high rates of arrest, limited access to health care, low utilization of evidence-based practices, longer stays in jail, higher recidivism rates, and more criminogenic risk factors. Additional challenges, just to name a few, include a lack of alternatives to arrest and options for crisis responses, scarce capacity of behavioral health services, lack of diversion options and information to inform pretrial release, and ineffective probation approaches for people who have mental illnesses. To address these challenges and reduce the number of people with mental illnesses in jail, a growing number of communities are implementing behavioral health diversion programs as alternatives to conventional criminal justice case processing and incarceration, namely by connecting people to the appropriate community-based treatment and support services outside of the criminal justice system. We released a publication, Behavioral Health Diversion Interventions, Moving from Individual Programs to a System-Wide Strategy, to provide common terminology for the word diversion and common terms within diversion. I'm sure you all have experienced people who are from different agencies, whether it's in criminal justice or behavioral health, have a different definition of diversion than you do. So we wanted to be sure in this document to provide a common terminology for diversion-related terms. We also aim to provide examples of diversion programs that can be started by the key criminal justice system stakeholders, or law enforcement, jail, pretrial, and courts. And then we also want to provide strategies for building a system of diversion. So not just focused on one program at one point in the criminal justice system, but really having options throughout the criminal justice continuum. To achieve the greatest impact and reduce the overall number of people who have behavioral health needs in the criminal justice system, communities must have a range of diversion programs and practices embedded within a comprehensive, coordinated strategy, which offers behavioral health diversion interventions at every point in the criminal justice system and fully leverages the community's resources. To do that, there will need to be an investment in a range of systems, programs, and improvements to create a continuum of diversion interventions or a system of diversion. Behavioral health diversion interventions within a community's criminal justice system can be used to connect people to community-based treatment and support services. These opportunities range from interventions that operate prior to arrest and booking by law enforcement to those that provide alternatives to incarceration at adjudication or sentencing. Connections to community-based treatment and support services would include case management, mental health treatment, substance use treatment, and supportive housing. So, of course, diversion and getting folks out of the criminal justice system is important, but you'll need to have the community-based treatment and support services available to connect those folks to upon a diversion intervention. One of the questions that comes up related to diversion is, does diversion work? Well, it certainly can. It can reduce jail days on your current case. It can reduce court costs. It can increase treatment engagement. And overall, it can save your system money. It cannot eliminate new crime, new violent crime, mental illness, or homelessness, but it could reduce them. So diversion works best when there's a cross-systems divergence strategy. And I mentioned this in a couple of slides ago. While the opportunities for behavioral health diversion look different in communities across the country, leaders are seeking opportunities to build bridges across systems to create community-wide strategies that have the greatest impact. In some places, the leadership comes from the courts. In others, it comes from law enforcement, where the jails are leading the efforts. But wherever they sit, these leaders are learning that the overarching elements needed to create a holistic and effective diversion response strategy include the following key components. Again, none of these are probably going to be a surprise to you, but developing and engaging collaborative partnerships, understanding your community's behavioral health needs, identifying existing services and supports and gaps, defining key measures and collecting data, leveraging funding to prioritize interventions, and measuring and sustaining progress. So the publication that I discussed earlier aims to provide local leaders with a system-level conceptual framework for developing a continuum of behavioral health diversion interventions that span the community's criminal justice system, starting with first contact, law enforcement through incarceration. In addition to that conceptual framework publication, we also released 2 publications, one on court-based diversion and the other on jail-based diversion, to provide leaders with a menu of potential processes and practices that they can implement to facilitate diversion interventions. Our aim for this suite of publications is to provide leaders with a common diversion language and conceptual framework to develop a thoughtful systems-wide behavioral health diversion strategy that builds a continuum of behavioral health diversion interventions into the criminal justice system and to provide some potential processes and practices to consider to facilitate those diversion interventions. So that was a lot about concepts behind a diversion strategy and developing a system of diversion. I'm now going to turn it over to the folks in Fulton County, Georgia and Atlanta, Georgia to talk a little bit about what it looks like in practice. So first I'm going to turn it over to Kristen to discuss their stepping up and cross-system strategy.
Okay, well, good afternoon, everybody. Again, my name is Kristen Schillig. I work for the Fulton County Superior Court, and I serve as the coordinator for Fulton County Stepping Up Initiative and the Justice and Mental Health Task Force that we have here in Fulton County. So I also manage a new Familiar Faces project funded through BJA Justice and Mental Health Collaboration Program grant, where we are matching data from the jail, homeless services, and healthcare systems to develop more responsive programming for this relatively small group of people who are touching all of those systems. So I guess next slide, Sheila. So I'd like to go over a history of our Fulton County Stepping Up effort to really demonstrate how we're working towards achieving our Stepping Up goals. So we started, I guess, starting with committed leadership, and I know in that framework that Stepping Up provides. In Fulton County, we have been very fortunate to have leadership within my own agency in Superior Court through Judge Doris Downs, our various chief judges, our district court administrator, public defenders, lots of elected officials, but also with our county commission. So Fulton County Commissioner Joan Garner was very involved with the National Association of Counties, or NACO, and she recognized really early on that Stepping Up provided that framework that we needed to make real change in this area. So she sponsored our Stepping Up resolution that was unanimously adopted in May of 2016, and she encouraged our little group to go really all in on this work until her untimely passing in 2017. So I know some of you listening may be in a spot we found ourselves in a few years ago. So we adopted the resolution, but really now what? This work can be very daunting. I'm sure you all know that, and it's really even hard to know where to start. And we've got lots of problems to solve. So I thought I'd share some of our challenges that we, just really barriers in the very beginning, some hurdles we had to overcome. And really, I think it demonstrates why we never really made the real systems change, like the big systems change, before we stumbled on Stepping Up framework. So, and I guess to be clear, we all need to be really comfortable talking about our problems when we do this work, right? So I might as well just put it all out there. So Fulton County is the most populated county in Georgia, and it's home to Atlanta. Our population is about 1 million people, and we're part of a larger metro region of about 6 million people. So our laundry list, just quickly, that makes strategic planning and systems planning very challenging is we have pretty significant problems with our jail, with overcrowding, the conditions. We have 2 different legal systems here. We have a city system and a county system and lots of crossover. Georgia is still under a consent order for conditions in our mental health institutions. Budgets are just really linger at the bottom as compared to other parts of the country. Income inequality in Atlanta is is some of the worst, really, too. And then racial disparities are extremely significant. So these are just some of the massive issues. And so we just knew, I guess what I'm getting at is we just really knew we needed help with this planning piece. So to get started, we in Superior Court applied for and we were awarded a 2016 JMHCP grant. And with grant funding support, we went through a really rigorous 18-month planning process. I could talk for a really long time about planning, but I tried to simplify it in a couple bullets here. So what the funding did is it gave us the opportunity to hire a group of consultants from the University of Georgia Carl Vinson Institute, and they really supported our convenings. They conducted the analysis that we needed and made sure that our recommendations that came from our planning work groups connected to the stepping up key measures. And I guess the method in which we went really unpacking the problem, our first step was doing a sequential intercept mapping workshop that was conducted by Policy Research Associates. And that was a 2-day workshop where we mapped out our systems and really documented how and where people were interacting with the justice system. And then in this workshop, we also collectively decided how to organize our work groups to really push the work and move the work and the planning work forward. And so after that SIM workshop, we began convening task force meetings. We held work group meetings. And these work group meetings were organized around pre-arrest type initiatives, housing, court collaboration, because again, we have lots of layers to our court system, which is very complicated. And we needed to unpack that, reentry planning, and then data sharing. So those were really our focus areas. And the result from that is we developed a formal report. We prioritized our recommendations and really the strategies on moving forward and built out some business cases around our top prioritized recommendations. So lots of really blood, sweat, and tears went into that planning. All this information can be found. We have a website, which I think I have at the end of my presentation, but it's fultonstepsup.org. We have all of our documents and reports and all kinds of stuff on that website. So check it out. So next slide, Sheila. Okay, so this is, I'm sure you've seen this, but this is just, I wanted to include it. This is our sequential intercept mapping workshop, and I really highly encourage everyone to engage in this process if you haven't already. It does serve as a very good catalyst and really a starting point to build out the systems of diversion and evaluate the off-ramps and where the off-ramps need to be. Also worth mentioning is that we went through a more in-depth process after this initial SIM workshop where we did what we call swim lanes. And those are really activities where we got really deep into the weeds. We looked at, or I guess at least tried to look at additional data from law enforcement, pretrial, our courts, the jails, healthcare, and housing, the housing services. We knew we just really needed to dig deeper. And those swim lanes are also on our website if you're interested. And I guess really the common theme that connects all of this planning work is, and what we say, it's sort of our rallying cry, I guess, is really divert to what? You know, we talk about diversion and how can we reduce the jail population, but our common phrase is just divert to what? And so yeah, that underscores everything that we do. Next slide. So now we have all our really lovely plans. They're, in my opinion, very beautiful and I think well thought out and collaborative and strategic. Our leadership was engaged, but really we had to think about how are we going to pull these plans off, right? We knew we didn't have enough capacity to do it. This does not fit, this kind of work does not fit. We knew we needed more people to engage, I guess is what I'm trying to say. So, you know, we're really big and complicated, as you can see from these numbers. Just looking at our Fulton County jail bookings, and this is in 2018. So we had over 25,000 bookings. Grady is our safety net hospital here in Atlanta, so over 140 ER visits. And then our Partners for Home, which is our City of Atlanta continuum of care. And this is just a point in time count, which we know is not inclusive of everybody, and it also does not include our Fulton County continuum of care. Just so lots of homeless folks living in our community. So we also just needed more data. We did not have the kind of data that we needed to keep on moving. Yeah, lots of challenges. So that's what kind of, okay, next slide, Sheila. So in order to kind of continue scaling the work, we applied for another JMHCP grant, which we were awarded. We had a really good experience in the Category 1 phase, and really we were offered a lot of opportunities through that planning grant. And really how we came up with this proposal is in 2018, we had the opportunity to go to the Best Practices Implementation Academy, where we learned about this Familiar Faces data matching project, and really got inspired by that work. Because again, we know there's just a small group of people that we want to support, and they just haven't received the right kind of care. And this is really due to our lack of system coordination. And we needed to figure out who are these people, and what are the best services to address their needs, and really needed this kind of systems-wide approach, but to really get into that granular work. So we got this Category 3 grant. It does cover my position and my role. I was able to hire a statistician, which I will say is a complete game changer if you're able to do that. Our partner in this grant is Grady Healthcare Systems, and it's just really important to get providers to the table and formalize those relationships, and just continue with that big systems kind of work. We also, through grant funds, were able to engage with a researcher who's done this sort of data matching work and this big system work in other jurisdictions, and we simply could not do it without that kind of technical support. So very grateful for that. And again, just looking at systems-wide approaches, looking at our shared goals, and we just want to be data-driven. So this grant allows us to kind of keep pushing this work forward. So next slide. As far as our key activities, we just continue to promote our vision, really just a systems transformation. We want to continue to reduce the reliance on the legal system and really shift the burden. We spend a lot of money on jails and law enforcement responses, and we want to just continue to shift that system and invest more in our community interventions and community programs. So what kind of the practical part of this is we did develop a working data team through this project. We continue to figure out ways. So out of our planning, we had 25 recommendations, and just figuring out ways to organize that so we can keep pushing the work forward, which is very challenging. As far as the data piece, we are conducting cross-systems data analysis, just tons of data work, which I'll get into in a minute. We also need to implement this process. So once we do identify with this Familiar Faces project who the people are, we are trying to figure out what's this process of screening look like. And then obviously collaborating with our providers to improve services and prioritize care, looking at funding and how we can be smart about funding, and then evaluation. So next slide. So real quickly, and just to emphasize a systems-wide approach that's already underway here, our grant, really I look at it as a way of scaling up things that are already underway. It's really just providing more of a pathway into the legal system. So we have our first Familiar Faces project with our Fulton County Superior Court, but Partners for Home, which is the Atlanta COC, is also doing sort of a Familiar Faces project using HMIS data. They're looking at Grady ER admissions and some local jail data. And then Grady, and I'm sure many of you are familiar, lots of healthcare systems across the country do this sort of Familiar Face project where they look at different kinds of hospital data. Grady specifically looks at emergency and inpatient utilization for their project. So next slide. So how we identify our familiar faces, and again, just looking at data, and we are still really in the beginning process of this. And there's just lots of crossover between the systems, and I think that's just really important to emphasize. So we're doing a local jail, So we're doing a 3-year data extract from Fulton County Jail and the Atlanta City Detention Center. We are looking at bookings and releases in all jail episodes at both jails. And then we reorganize the data into a charge-based, looking at charges into the episodes. It's really complicated. And I'm trying to explain this in a way without any of my research or statistician pieces here. But, and there's lots of coding that goes involved in this as well. But I guess for me and where I come in, and the part that's less technical but equally important is getting engagement from the other agencies that we want to pull data from, right? So I'm sure you can imagine this is very challenging. I mean, we had challenges even getting our own data from my own system that I have access to. So my role is really reaching out to these other entities and talking about our project, the need for the project, and really getting them to share their information with us. So there's lots of work that goes into that. It takes a lot of time. Do not underestimate how long that takes and how challenging it can be at times. So we're looking at all of the Georgia Department of Corrections information, the Department of Community Supervision, which is our probation and parole, Grady again, which is our healthcare system. We're also looking at, I didn't mention it on this slide, but Emory does our competency evaluation. So we will be matching some of our competency data with this for this cohort. And then obviously DBHGD in our housing systems through HMIS. So lots of data. It's fit pretty cleanly on this slide, but I will say it's just, there's a lot that goes into this if you're getting into this kind of work. So next slide. Okay, so lastly, I just wanted to briefly touch on a new research project that will provide some foundation for Moki, who's your next presenter, to talk about how the LEAD project is expanding, but it also does tie into our Familiar Faces project. So the way I look at this research, I think Moki would probably agree with me, is that we probably should have started here. It's really so relevant in how you look at systems and how to really plan out diversion. So I put a lot of words on this slide because I don't want to mischaracterize any of this research, and I'm not super familiar with it myself yet. So we know that police spend significant resources responding to 911 calls for service, and we need to better understand how these services, some of these services might be rerouted to 311 or community-based services. So we need to reliably distinguish calls that require that immediate police response from those that don't, because obviously we want to improve outcomes for everybody involved. So there's a research team that's currently analyzing over 3 million calls for service over a 3-year period here in Atlanta. And they're looking at lots of things, those call types, response types, and outcomes, and really the relationship between them, and trying to identify and geolocate the types of calls that would be most suitable for diversion. So basically just really unpacking all those 911 calls. Why are they doing it? Coding, trying to figure out, what alternatives make the most sense for this group of people, right? So again, this study is going to inform the data-driven efforts to expand, which Moki will talk about. But it's also an important link between and some of this preliminary data that we've been looking at. So in my Familiar Faces project, our top jail charge is illegal trespassing, right? So about 25% are illegal trespassing charges. And I think it's interesting that the top probable cause indicated in this PAD data or the pre-arrest diversion data is also illegal trespassing. So we're just seeing these things connect from where Moki sits and where the potential for alternative responses sits to where I sit and really looking at the jail charges, the people who are in jail and why they're in jail. So really it's all connected. I think this is such an exciting project. I'm super excited for you all to hear from Moki and Renette about the kind of cool work that they do. And I think, Sheila, I think I put my website on the next slide, and then that ends my section.
Thank you, Kristen. Really appreciate you providing a kind of an overview on how stepping up has influenced your systems thinking and how you were able to get a system strategy going by starting with the SIM model, making sure the partnerships were in place, and really identifying the people through familiar faces and what the community needs were to be able to establish some of your next steps within your system planning. Now we'll turn it over to Moki to tell us a little bit more about the PAD program. Moki?
Thank you so much for the opportunity to be here today, and to Kristen, who has been leading so much of this conversation over the last few years and really, through blood, sweat, and tears, pulling together the various stakeholders. So I've personally had the opportunity to learn a lot from Kristen's systems approach, and I think it has certainly informed the way PAD has developed over the last few years. I'm excited to be here today just to share a little bit more about Atlanta Fulton Pre-Arrest Diversion Initiative. And I know probably the richest part of the session will be in our conversation and certainly the questions from all the folks listening. So I'm looking forward to that as well. If we want to go ahead and jump into the slides, I can give you a bit of an overview. So Atlanta Fulton PAD came out of a grassroots effort. It was really a part of a broader criminal justice reform strategy that community organizers and advocates, along with social service providers and elected officials, really started thinking through back in 2013, 2014, as a way to address the sort of broken window style policing that was still happening in the city. And so, really looking at recognizing where individuals, like Sheila spoke to in the introduction, where individuals who are in need of behavioral health services and other supportive services are continuously getting caught up on low-level charges that result in their booking and detention at either our city jail or our county jail. We've been accepting diversions from law enforcement since 2017 and have diverted over 200 people in zones 5 and 6, which is kind of the core of the city of Atlanta, working with the Atlanta Police Department. So just to give you a sense, that the issues that we divert for are related to problematic substance use, to unmet mental health needs, and to extreme poverty. And we base the program on the LEAD model, which is law enforcement assisted diversion, which was first created in Seattle and has since been a model that many, many jurisdictions across the country have taken up. Where we differed a bit in our initial planning period was, instead of selecting charges for diversion, we really focused on the types of behaviors. And all of our training for law enforcement, for prosecutors, for community members has been focused on, if there are particular behaviors that seem that that folks need assistance and connection to care, then it's actually that we're less concerned about the type of charge. What we've seen is that, for the most part, the types of charges that end up getting diverted to us for law enforcement, are, tend to be city ordinance violations or fairly low-level misdemeanor charges. What we are hopeful about, though, is that as we continue to grow as a program and as we continue to be a part of a broader conversation about what really does make our community safer, that we would be seeing more serious drug-related charges and eventually charges that relate to more interpersonal harm as we build out a more of a restorative justice focus, which we're not at yet, but I wanted to put that out there. You can go to the next slide. So just briefly, what happens when an individual is diverted from arrest? At this point, we are only accepting diversions from law enforcement when an officer has probable cause to detain somebody and where they have identified that the behavior, it warrants a connection to social services. So it's absolutely driven by officer discretion. But we have been very careful in our training and in our the documentation that we require that we are not interested in sort of net widening, right? We're not interested in making law enforcement, play a social service function more than they already do, right? But rather focus on if but for the individual would be handcuffed, brought to the booking facility and booked, that is a reason to then make a diversion to PAD. Not if, they see somebody and they think, oh, that person might need help. Not because we, don't believe people need all the help they can get, but rather because we are laser focused on converting arrests to diversions, right? Because we're really focused on driving down the arrests for these types of behaviors. So once we receive a referral from an officer, we provide that documentation, just name, date of birth, to our legal partners. So we work closely with both the county and the city prosecutors and public defender offices. And we start sort of the legal navigation process right at the beginning. There's the opportunity for a prosecutor to say, we're not really comfortable with this diversion, and here's why. That's happened in, I think, 2 cases so far. And it usually means we just have more of a conversation with them. So we really try and operate respecting the discretion of our partners and not asking people to do something different than what they, than what their role is. But what we do is we invite them in to have more conversation about what may be driving the behavior, what may people need in order to try and address it in a different way. So while we are not attorneys and we do not provide legal advice, what we do is we collaborate very closely with the public defender's office. And so, oftentimes the folks that are diverted to us already have open cases, and they often get rearrested after a diversion. In that case, we collaborate with the public defenders. While we meet with the prosecutors and the public defenders together, we are very careful about sharing information that are anything that would be sort of client privilege. We defer to the public defenders in order to share whatever information they feel is appropriate when they have consent. So on the, while that kind of gets going, our team is then working on providing sort of triaging basic needs, figuring out, have you had something to eat today? Do you have shoes on your feet? Starting to build rapport with the individual who's been diverted. And one hallmark of our program is that, of the vast majority, I would say, I think 93% of our participants who are diverted to us are experiencing homelessness. And so that's not a requirement for the diversion, but that is, just kind of what we see in our community. And so part of our program is to provide emergency shelter to individuals. We work closely with Partners for Home, which Kristen mentioned is our continuum of care locally. But we also have flexible dollars so that if need be, we can put somebody in a hotel stay for, a few days, up to a week, while we figure out a different placement. This is also really useful when you have somebody who may be dealing with, pretty severe paranoia or anxiety, has experienced violence in previous shelter stays, is medically fragile, right? Different aspects which would really create sort of a clinical basis for putting somebody in a more secure, private shelter space or environment. So we work with the individual around sort of basic needs, and then we begin case management. We're very much rooted in the approach that the LEAD model has really, I think, has just done a really beautiful job of not only developing but also disseminating, which is a harm reduction approach, and I'll speak more to that in a moment. But also going to where people are, right? So the expectation that people who are diverted are then needing to come to our office in order to receive support, it's just unrealistic, right? And so our team goes out and meets folks where they are. And if somebody gets diverted to us, they're not connecting or we're not able to reach them, then our outreach team, our harm reduction and outreach team go out and try and keep building that rapport. As a consent-based program, there are no sort of hoops people have to jump through, but we are doing really assertive engagement as we start to try and build that rapport so that we can help them identify what their goals are and then help them work towards those goals. We work closely with a network of service providers, knowing that we can't do it all alone. And I think to Kristen's point, the sort of divert to where becomes really critical, right? What mental health care can folks get connected to? What employment services? We do a lot of the work of case management, but we also try and connect people to additional case managers and other supportive services so that there's a bit more of a village surrounding that individual. Next slide. So just a few things about PAD's approach. I want to make sure I mention we have no exclusions based on criminal conviction history or on rearrest. And so that was something that was not an easy win at the very beginning of developing the program. It's in many conversations, it's sort of like that's that's just the expected, that it's sort of, people don't even think about why, right? But really thinking, really pushing forward that conversation of saying, if somebody has been convicted of whatever it is, right? Our system is operating on the basis of that was the punishment for the crime, right? And why should people have a life sentence if that was in fact the punishment for the crime, if they had served time or were under state supervision, and then also, recognizing that I think we're all very well aware of, that convictions create serious barriers across pretty much every facet of an individual's life. And so it is precisely the folks that are experiencing those kind of legal barriers that may end up cycling through the system over and over again because they're not able to access housing. They're not able to access employment. They may not be able to access shelter or kind of get their basic needs met because of previous convictions. And so it was critical to us that we wouldn't exclude people based on those convictions, but instead that this would be exactly the priority population we'd want to, connect with. Similarly, the question of consent, right? So traditional diversion programs, and as a field, I think there's a lot more understanding now about pre-arrest diversion, but court-based diversion programs, there is so much more emphasis on, okay, we're giving you a chance. Now we're going to tell you what you have to do to be successful, right? And for us, what we work on is a model of 1, consent, and 2, harm reduction, right? So that we are celebrating every positive change. And, our team laughs about, we'll say, like, it's not baby steps. Sometimes it's kitten steps, right? And so we are working with people to identify what are the things that they believe will stabilize their lives more, will create a better quality of life for them, and how are we helping to support that. It can be difficult for systems players to accept that as progress, but we have seen in the stories of the folks that have actually been really successful with PAD that we have very good sort of examples of why this kind of consent-based sort of harm reduction approach is really effective. So certainly, for us, it's not just about the individual and their improved quality of life, but also how that trickles out into the communities they're in, and how we can continue demonstrating to the systems players that when we move from a punitive approach to a care-based approach, we are actually really part of a culture shift overall that we desperately need. Next slide, please. Thank you. So I just want to make sure I'm just clear on this. For us, what we do when training officers and training prosecutors, actually, we've started to accept some referrals from the jail, particularly during COVID, from prosecutors. But the idea of consent, that the individual is able to consent, and that it is not a crisis. And so that's a key piece I want to mention, that when somebody is experiencing a mental health crisis, or is at risk of harming themselves or somebody else, we will work with the responding officer to use their existing protocol to bring in the right crisis team. But for us, it's been really important to kind of draw a line between the sort of harm reduction work that we do and then what a mental health crisis team would do. And so you'll hear more in a little bit from Raynette related to the mental health crisis services available in our area. Next slide, please. I want to just make a note, and I think we'll come back to this in the conversation or in the panel, but we work, I think what works so well about LEAD, what really has made me a champion for LEAD is how much we collaborate with the criminal justice agencies. It puts us in a position to be able to share with the criminal legal partners what progress is being made that they wouldn't otherwise see. And we're very careful about respecting people's privacy and, not sharing, diagnoses, not sharing, kind of the more, information related to somebody's personal trauma or experiences, but rather letting people know, yeah, we're actually making some progress. We are working on housing placements. We are working on X, Y, or Z with these individuals so they can see, even if somebody may have gotten another arrest in the meantime or may have a failure to appear that we need to resolve, that they can just see the progress that we make along the way, and then that we're working on also resolving past cases, right? Most folks are coming to us with open cases or with other legal issues like, documentation issues or issues related to child support, right? So issues that if we can connect them to legal support through our public defender's office, then we're able to sort of help reduce some of those barriers as well. Next slide, please. So I wanted to say a word about our strategies as we seek to expand. So this year we are beginning the process of expanding our law enforcement assisted diversion citywide. Right now we are in 2 zones out of 6. So those are the zones that end up having the most types of arrests and enforcement related to the kind of issues that we address. So, but we are looking to expand across the city. And then the other aspect that we are working on, which I'm very, very excited about, is expanding to community referrals. So while we have been laser focused on converting arrests to diversions with working with law enforcement, what we have seen over the last 6 months is a huge shift in public will around, continuing to identify what the appropriate role is for law enforcement and what actually needs alternative responders, right? And so we are working with our non-emergency services line, our 311 line, to be able to accept community referrals for the same kinds of community concerns that we're currently accepting diversions. Supporting both of those, and I'll dig into that in a moment, but supporting both of those is our harm reduction work. So really focus on how are we engaging all of the stakeholders that touch this issue in thinking about harm reduction as an alternate response to these types of concerns, right? And that means street outreach. That means going out into the community and talking to business owners, talking to people who are concerned about what's going on in their neighborhood, talking to law enforcement, right? Really helping to kind of push that conversation forward through building relationships and just being present in the neighborhoods about, okay, so, we acknowledge that these are concerns in the community. What is a better way to sort of start addressing these concerns? So we have a lot of conversations with people where we're really asking people to think beyond what has become for many a knee-jerk response of, well, that is against the law. And so therefore, the way to address it is you call 911 and the police show up, right? But rather, that is a legitimate concern that somebody's experiencing severe hardship, right, on your doorstep, right? How through harm reduction, how through building relationships and connecting people to care can we start addressing those issues in more substantive ways and reducing the pressure on the police department to sort of command and control, right? To enforce through forcing compliance, right? Which we know it can be highly problematic and can lead to bad results. Next slide, please. Okay, I think this is my last slide. So I just want to say a little bit more about community referrals that we're working on. We should be launching with the 311 system on November 1st of this year in a limited geography. But 311 will be able to accept calls from community members that have community concerns related to substance use, mental health, or poverty. They will then dispatch, the 311 team will dispatch our harm reduction teams, and we will either respond sort of within 30 minutes for those calls that need an immediate response, or we will add the request to our outreach queue and respond within 72 hours. And so we're working through the criteria around that right now with 311. But the idea is to provide an alternative to police response and a connection to other service providers with the understanding that if we are engaging individuals who have open cases, we may also propose their enrollment in our lead diversion program as a way to offer sort of a deeper level of support and navigation around some of the legal issues. So that I think, is something that we're going to learn a lot along the way about how to do this well. And I hope a year from now I can be, presenting another webinar on the community referral process. But that's where we're headed. That's it from me. Thank you so much.
Thank you so much, Moki.
Good afternoon, everyone. My name is Renette Arnold, and I'm here representing today Behavioral Health Link. I want to thank Sheila and her organization for providing this amazing platform for us to share our work, and I'm so excited to be here with Kristen and Moki today to talk about some of our programming and collaborative efforts that have been amazing and instrumental, and we look forward to the ongoing progress that we will do moving forward to serve our community. Next slide, please. And so I'm here representing an agency in Georgia called Behavioral Health Link, and one of our taglines is "A crisis has no schedule." And so, as you can imagine, when we are assisting with individuals in crisis, that it doesn't matter the time of the day, individuals need help and support. And so through Behavioral Health Link, we're able to do that and assist other programs and help become more involved in this systemic approach through two areas or two programs: our contact center, which is commonly referred to as Georgia Crisis and Access Line, as well as our mobile crisis response program. And so I want to give you all an overview of what those two programs look like, with the hopes that you will be able to identify programs within your community or may be able to shape a model that may work for you all as well. In terms of the contact center, it is a 24/7, 365-day-a-year call center. And so with that, individuals are able to access a licensed mental health professional, again, 24/7, whether it's the person at risk, a third-party provider, law enforcement, another supportive service provider, et cetera. They are able to contact this 1-800 number to get the assistance that they need. Once that number is activated, a crisis assessment will be done where we're going to gather information and data. Who is the individual? Where are they located? What are they presenting with? What resources are available? With the focus on how do we connect them to services, but also how do we connect them in a timely manner. Particularly, one of our other programs is the Mobile Crisis Response Program, and this is really where we're able to, again, assist with law enforcement, assist with diversion, et cetera, because when those calls come into the contact center, even if it's from law enforcement or through an outside person or provider, we are able to dispatch mobile crisis. What does mobile crisis look like? It's a licensed mental health professional who responds with another support person. It could be a clinician or a person with extensive behavioral health history, et cetera, where we're responding in the community. And so we've been funded to do this work since 2013 in this area. We've been providing services since 2006 in terms of our contact center. So we are a specialized crisis servicing agency who receives funding to do this work. We have the infrastructure
already there in order to provide services and support. And again, our focus has been to provide that timely access to whatever level of care that is needed. And so Moki spoke about crisis services. Again, we're focused on doing a systemic approach. Behavioral Health Link is one of those key partners and champions that is already doing the work. And so it's helpful when you can tap into an infrastructure that's already doing the work, that has funding available, so you can just align and partner and figure out how can we work better together. Next slide, please. And so you've heard this word throughout the presentation: collaboration, collaboration, collaboration. We cannot say it enough. And so to me, when I thought about this, all of the terms that go into collaborating are on this slide right here. Next slide, please. And so cross-system collaborations, as you can see from my title, it's evolved from community collaborator to community relations and education coordinator, but the spirit of it is collaboration. And so one of the things that we've always looked at as an organization is, how do we build cross-system collaborations? I'm thankful for our funders. Kristen mentioned DBHDD as one of the primary stakeholders in terms of sharing data, et cetera. They're actually the funding agency for the work that I'm able to do under Behavioral Health Link. And so in that grant, they actually wrote in a community collaborator or a community relations and education coordinator, where the primary responsibility is building community collaborations, establishing relationships. And most importantly, when there are things that do not go right as we would like for them to go in the community, who is that person who can reach out to those organizations, go out and visit or do presentations or attend those task force and work group meetings, so that we can be a voice at the table and be solution focused in how do we drive these missions forward. When we're building cross-system collaboration, we're looking at what are the needs of the community. And so we had to sit down and figure out, how can we not work in silos but become a part of the solution? How do we have a voice at the table within diverting individuals from not only the criminal justice system, homelessness, from different levels of cares, et cetera? How can we add our voice at the table so we can help individuals get to where they need to go? You want to look at who are your stakeholders, who's available in the community. We're fortunate to have a lot of resources in Fulton County, as you can see, particularly from the diagram that Kristen put up and the intercept mapping. But that doesn't mean that your community cannot do it just because it doesn't look like ours. It's important that you assess and find out who's available in your community, who's showing up, and if they're not showing up, reach out to them in their organization to engage them and possibly ignite that fire and let them know that they're welcome to come collaborate. That focuses on the same thing as the importance of outreach and engagement. One of the things that has made us extremely successful, I know BHL has the spirit of collaboration. Fulton County Courts has the spirit of collaboration. I love getting calls from Kristen. Kristen keeps us engaged and moving along, and we'll pick up the phone, and she's not afraid to say, hey, this is what we're working on, or what do you think about this? Moki as well. We are remaining in contact and talking about our programs, even when things are not going right, to figure out how can we move it forward. Establishing a platform to collaborate. Kristen talked about the work group meetings, the task force, et cetera. You want to establish a common meeting ground to say, how can we come together? In addition, when BHL got the funding to provide crisis services, we also were, one of our deliverables is to focus on providing a community collaborative meeting space. And so we were doing quarterly meetings as well as an opportunity to engage our stakeholders. Tracking outcomes and data sharing, and then continued engagement with our stakeholders. This is not a one-stop shop in which we come together and meet and we develop a plan and we say, okay, we got it, and then we move forward and the system works perfectly. As you can hear, we are consistently and constantly planning and strategizing and redefining and amending the way in which we do things, because what we understand is that no solution is a one-size-fits-all, and we're trying to meet the needs of the community. Next slide. And so we wanted to highlight some of our current partnerships. One of our Our favorite partnerships that we are so proud of is the Grady EMS collaboration. And so this is a co-responder model where we are fortunate to have a Grady EMS paramedic and a BHL mobile crisis clinician riding together in their vehicle. They have the lights, sirens, bells, and whistles. And so they're able to get in and out of their catchment area and provide that crisis support and also do the medical clearance piece. And so this has been absolutely phenomenal. They're dispatched from the 911 system, and so they're responding to calls within 40 hours a week from about 10 a.m. to 10 p.m. to, again, assist in the community and provide that diversion from not only the criminal justice system, but also entering the emergency departments. When we got the funding to provide crisis services in our area, one of our main, actually two of our main goals is to reduce the unnecessary involvement of law enforcement, but also reduce the number of people directed towards emergency departments as well. We want to link them to emergency receiving facilities so that they can get the psychiatric care that they need and not spend those tax dollars in terms of services that are not needed or force individuals to be waiting in the emergency departments for a placement as well. Some other collaborations that we partner with, of course, Fulton Justice Mental Health Task Force. We still partner with the Suicide Prevention Coalition, the Homeless Task Force, and then there are many formal and informal collaborations with law enforcement agencies, FBI, and even the GBI. One of the most inspirational things that I'll share with you all is we have a spirit of showing up. And so even if we don't know what is going to come out of the meeting, or if we're going to a training, or if we're going into faith-based communities in order to provide support or awareness about our program, we show up and just share information about our organization. And then out of that, through relationship building, oftentimes there are additional opportunities that come out of that. If we're able to get a formal collaborative effort or an MOU, that's amazing, but also our informal collaborations have done very well for us in the community as well. Sometimes, depending on the agency, it can be very difficult or challenging because of our legal departments for each separate agencies, et cetera, to kind of get those formal infrastructures built. But it's about keeping in touch with individuals. Key champions is what I call them. Who are the people who are within those agencies who get the mission of what you're trying to do, who you can call and talk to and problem solve as well so that you can get things done within your area. Next slide. And so thank you for hearing about Behavioral Health Link in terms of the services that we provide, and I look forward to talking to you all again during the panel.
Thank you so much, Renette. So what I wanted to do now was ask the panel some questions. A lot of what I discussed at the beginning of our introduction, I would say made it sound pretty easy, right? Create a system of diversion, have different diversion interventions throughout your system, and have a connection to community-based treatment. But it's really hard. It's a very difficult thing to do. It takes a lot of time, a lot of effort, and a lot of detailed planning. So what I wanted to do during this portion of the webinar is just ask the panel some questions to kind of dive into some of the details on how they were able to accomplish what they have been able to accomplish. And I know that within Fulton County that you do have diversion interventions throughout your criminal justice system, within your court system, et cetera. But this presentation, I know that your most recent focus has been around pre-arrest diversion. So definitely want to talk a little bit about how you were able to arrive on that intervention point. So I see that we're sort of getting to the end of our time, and we do have some questions from the audience that I want to be sure to relay to you all. So I'm going to kind of skip ahead a little bit in the questions that I had planned for our panel, so we'll be able to have time for questions from the audience. Here I brought up the slide that talks about the different elements of a diversion strategy and wanted to talk through some components of it. So one of the questions that I had is going to be around understanding your community behavioral health needs. Like I just mentioned, I know that you all have some diversion interventions later on in the criminal justice system, later on down the stream, but you all have focused recently on pre-arrest diversion. I'm wondering if Kristen and Moki in particular, but Renette, please also feel free to jump in, could talk about how determining what your community behavioral health needs are brought you to the PAD program, as far as looking for a pre-arrest diversion program to be able to hook folks to services.
Moki, do you want to take this, or do you want me to take a stab at it?
I can start if you'd like.
Yeah.
Yeah, thanks. So like I alluded to, landing on law enforcement assisted diversion through PAD really came out of a grassroots campaign that was led by criminal justice reform advocates and community members. And so I think it makes us quite unique from other diversion programs, and I think that sort of origin of the program has created a different responsiveness to listening for community needs and to soliciting that information along the way. So, I think certainly with the Stepping Up initiative and the process of identifying all of the stakeholders and the kind of inflection points, Kristen will do a better job explaining that than I. But I think for us, there was a clear sort of call to action from a diverse group of individuals to say we need something else here that is basically directed to that initial police contact. That's really focused in on how do we improve that contact and how to create an alternative pathway into our service system instead of arrest based on that initial contact. I will say, as that campaign grew traction, we did a few things. One, we did a survey of social service providers so that we could understand what were the gaps that social service providers were facing and what were the potential barriers that people who were interacting with law enforcement may be facing in the social service system, right? Whether that was barriers based on the requirements for abstinence or documentation, barriers because of transphobia or homophobia, or other barriers related to criminal convictions. So we could paint a really strong picture as to not only why there was a need to divert individuals and to do so in a way where you had a team that could really hold people's hands to connect them to social services that may be hard to navigate, but also to say, alongside our work in diversion, we'd also need to advocate for and to social service providers so that some of the barriers that they may be putting up could be addressed as well. So certainly, the survey of service providers, and then also staying really connected to the community groups that were being loudest on the issues, right? That's something that sort of initiated the PAD program, but also something that for us has been very critical to remain in relationship to those folks that are critical of policing, that are critical of the current approach, so that we can really be listening for what people are identifying as sort of pain points that we can help respond to.
I guess what I would add to that, and just thinking of the systems shift that really needs to happen is, our system of care here and looking at the broad picture and understanding the behavioral health needs. We have a big state system. Everything is just really underfunded and it's very complicated. And I guess we just really need to decide, the funding silos need to be shifted in a way that, we're supporting, we need to bring the systems together and shift the focus again on the front end of the system. There's been study after study to try to understand our capacity issues, and we have massive capacity issues all across Georgia, but especially in Atlanta. We have lots of wonderful programs, but not enough money to support them fully, right? And that's what we want to get to, and just making sure that we're funding what's meaningful, what's impactful, and really just getting more bang for our dollar, right? Because there's not a lot of dollars just to go around, and especially now with all the challenges that COVID has faced. So I guess it's sort of like the big picture issue and trying to get the systems to work together to best serve the people that we're trying to serve.
Yeah. And I'll add to that in terms of, so I totally agree with both Moki and Kristen in terms of the capacity to serve, but also for the services that are there and available in our community, how to actually access and get people connected to those services within a timely manner. And so that has been our primary focus. How can we get in and use our specialized training so that we can help link individuals to those services to the appropriate level of care and make sure that those gaps, the individuals aren't dropped in the system. Another focus of ours is teaching our community about other resources, and so that they will learn not to rely on the criminal justice system or law enforcement or calling 911 for help around crisis services. So there's a huge education piece as well in terms of the community's knowledge of what behavioral health looks like and what services are available for people to access as well.
Great, thank you so much. I mean, this definitely sounds like, you know, to understand the community behavioral health needs, there are quite a few themes that resonate through there, but one that is particularly obvious is just listening to your community and listening to other folks and to really understand, to keep your ears open to have a sense of what people are asking for. I'm going to move to this next piece about identifying existing services and supports and gaps. You all kind of touched on this at various points, but, you know, thinking of the question, divert to what, right? Kristen, that was something that you had brought up, and Moki, I believe you had brought it up as well. You know, I'm curious about how you all have approached that question and being able to identify your existing services and supports and what's available. How have you started to approach answering the question of what can we divert folks to, what's available in the community? And this goes a little bit to your capacity too, like what is available, what's out there. I was wondering if the three of you could talk a little bit about how a review of existing services has been able to kind of open some doors for divert to what, or give you a better picture of divert to what, or what's missing. We know we need to divert to this, but that's missing right now. I wonder if you all could talk about that a little bit.
Sure, I can start this. So obviously, and like I went into with my presentation, we did our mapping exercises and really were able to pinpoint. And I think, you know, we do have a pretty decent infrastructure here. We have, you know, lots of programs that are, you know, spread out throughout the continuum. And I think for me, in sort of a shift in thinking is really, are we wanting to do pre-arrest work or post-arrest? And if our vision is getting to that fundamental shift that needs to happen, right? We need to start somewhere, right? Like look at the capacity issues that exist in some of our court-based programs because they're legitimate. You know, some of our, you know, mental health courts, they have some funding, but the service and supports don't exist, right, to support the success of the people going through that system. But for me, the shift, it just has to happen. Like our vision is to stop using or to reduce the use of the criminal justice system to address issues that could be better addressed in our communities, right? So shifting through that to that pre-arrest lens and focusing all our efforts there. And a lot of that for me, and you know, I sit in a powerful agency, a superior court, is just giving a platform to the agencies that are doing the work. And that's why you have people like Moki and Renette. I have them on speed dial and try to give them a platform whenever possible, because that's what I know I can do, and support their efforts to leadership when it gets challenging or sticky, or, you know, they're having a hard time understanding our vision. You know, a lot of leaders get real stuck on our jail problems, which are significant, and especially in COVID. But again, like reminding them of our vision, again, reducing that reliance on the system and investing in our communities. So that's what I'll say.
I would just add two quick comments on that. One is just recognizing housing and how critical housing is, particularly housing that supports a housing first philosophy. right? So ensuring that you are connecting with your local housing providers and that whole ecosystem, and really continuing to promote housing options where people do not have to be abstinent, where people have multiple chances, right? But as just being a key piece of keeping people out of the system is that if people are housed and are able to be housed in ways that are, understand the process of recovery. The other thing I would mention is just speaking about the importance of just recognizing that, like, on the one hand, it's, we need all that safety net there, right? And we need to keep advocating for expanding that safety net so that we're not relying on the criminal legal system. But I think, we should be thinking about this in the context of broader criminal justice reform. So to say, success for us is not diverting 500 people on a panhandling charge, right? Mm-hmm. It has to also include that we change our panhandling ordinance so it is no longer an offense which somebody could sit in a cage for 6 months on, right? So just kind of contextualizing, not just building out the diversion infrastructure, but also thinking about how we need to look at decriminalization and other policy changes as a way to reduce that over-reliance.
Thank you for sharing that. And this is why I love being a part of this, again, this type of systems approach. What we know is that when we tend to know better, we do better. And there's an evolution of our services and the way in which we engage. One thing we do know, unfortunately, as a system, because of funding opportunities or the lack thereof, because of the capacity to serve, there may be gaps. But how can we sit down and strategically target these gaps, develop solutions, and move forward? Even the smallest changes can make a difference in the work that we are doing. Again, Kristen has been able to provide an amazing platform and opportunities for partners to be at the table. And what I found most recently in doing this work is that partners are there, just unfortunately either those agencies may not have the capacity to do a lot of outreach and engagement and get out of their offices. But if you can find a way to engage, pick up the telephone, go visit their agencies and really be solution focused, then we can address some of these gaps. It's not to be embarrassed. The system is what it is. Mm-hmm. But we want to create a spirit of how do we identify solutions and really understand where each other is coming from. One of our best methods in doing this is to really be open and honest and be objective in the work that we are doing. When we are doing this, we're focused on a common goal in terms of this is the overall mission of this program. We want to divert some of those 2 million individuals from the criminal justice system and route them to where they need to go. So if that's everyone's goal and we're not tied specifically to our agency, then I will be able to open my mind and heart to hear what those other agencies are doing. What is their focus and why are they responding the way in which they're responding? A lot of the challenges or the misunderstandings and the bumping of heads between organizations or systems was because we don't often understand why a system or an agency is responding the way in which they are. And oftentimes it goes back to their policies that were written, predated before time when we didn't know how to truly meet the needs of individuals or what the impact of the system was on our communities. And if we can talk about that and come to a common consensus. And oftentimes we're able to modify some of those policies or at least look at it and say, hey, this is where we are going wrong as a system and this is the fallout. Those conversations have been super impactful for us in our community.
Awesome. Thank you all so much for sharing your responses to that question. All solid, great responses. I do want to turn to give some of the audience members a chance to ask some questions. We've had some questions come in. One of the questions, and you all have highlighted funding at various points. One of the questions that came in was around the pre-arrest diversion program and how that's funded. Moki, I'm wondering if you could speak to that a little bit on the funding streams for pre-arrest diversion.
Sure. So Our funding has come from both the county and the city, so general operating dollars, as well as some key private foundation funders. What we have strived for is about 80%, 75% of our funding base to come from local sources, just because we feel like there is part of the idea of reinvestment and reallocation of local dollars into alternatives is important. That said, having private funders that are willing to fund more related to policy advocacy or more sort of, other aspects that local government may not be as excited about has been very helpful. I will say we've also applied for federal dollars in conjunction with our local Fulton Department of Behavioral Health, so we're waiting to hear on that.
Great, thank you. So it definitely sounds like a braided funding approach, having different sources to fund different pieces. One of the other questions came in from a defense attorney, and I think this goes a little bit to collaboration and building partnerships that you all have talked about. The question is, how have you been able to get buy-in from the defense bar? Or have you not? Or have you?
I'll take a first stab at this. And we started this project. Really, the SIM mapping gives you the prescription of the people who need to be at the table, right? Our DA, there was always representation in our groups. Sometimes I think in certain areas, maybe we'd be a little further if they would have been, more enthusiastic about some of our projects. But, again, like what Renette said, it's just, we do always try to listen and hear people. And I know that sometimes that's challenging with the prosecution side of things and also with the law enforcement side of things. But we never stop. We just keep trying and trying and trying to engage and make the work, relevant for them. But I know Moki's had success on her side about engaging prosecution because they are a key factor in how they actually operate. So maybe, I don't know, Moki, if you want to speak to that.
Yeah, and I can, and also to include the public defenders as well. I will say that the lead programs in many places are driven by prosecutor offices and often do not include public defense offices. And for us, from very beginning, we had public defenders at the same table as prosecutors every single step of the way. And there was some trust building that needed to happen. It was definitely challenging at times. I think we had a lot of conversation about, how we share information about clients. And I think what we got to was recognizing that everybody has their particular role to play, and we're not asking people to step outside of their role. So for our operational working group meetings, for example, we meet monthly, we convene the public defenders and the prosecutors. And at that point, prosecutors are going to share the information they have access to where is appropriate for them to share. And they have a very clear, they clearly understand that public defenders are going to be much more kind of close-lipped about the information that they may share about their clients. And so we see our role as sort of, we have one-off conversations with, kind of one-on-one conversations, I should say, with the public defenders, and then we'll have one-on-one conversations with the prosecutors, and then when we feel like we know what everybody's doing, we can bring them together and they can have those conversations. But we just try and work really clearly, we try and make sure that people know that we're not asking them to do something outside of what their role is in the system, but we are asking them to try and collaborate, doing problem solving where it's appropriate. So we've been able to gain a lot of support from our defense bar. I would say, if anybody has challenges with that, if you're working with your public defender offices and they have questions, we have some great partners at both the county and the city that we could set up a peer-to-peer conversation if that would be helpful.
Can I say, I just want to say one thing. I heard you say defense attorney, and then I wrote DA, and then I kind of flip-flopped them. So I would be remiss to say that our public defender's office at both our city and our county side are complete rock stars. They show up all the time, and I just needed to say that because I wrote it down wrong. So anyways, that's it.
it's great to hear that you have this collaboration and partnerships. I have one last question. We're running out of time, but I have one last question I want to try to squeeze in. I'm assuming this question is specific to the pre-arrest diversion program, which is, are the diversion clients assigned legal counsel at the outset and entitled to consultation?
Yeah, thanks for that question. I'll try and be brief. So no, we do not provide legal representation, but we do coordinate with the public defenders that if they have an open case or if they get a new case, the public defenders are assigned to them, and then they will provide ancillary civil legal support by nature of our partnership with them. So there's a way for them to receive legal guidance through the public defender's offices. Thanks.
Fabulous. All right, that takes us to time. I want to give a huge thank you to our presenters from Fulton County and Atlanta for talking about all of the great work that they're doing related to diversion, and I would say diversion and related to diversion, both pieces of that. So thank you so much for your time today, and thank you all for joining us.
Thank you.
Thank you. Everybody take care.